In trauma, we follow the principle of the ATLS. ATLS include A, B, C, D. A indicate airway. First of all, we access the airway patency, and we'll see the patient. The patient is conscious or unconscious, or is able to speak or not. If the patient is conscious or able to speak, it means the airway is protected. But if the patient is not able to speak or unconscious, it means it is not patent. Airway is not clear. In this case, first of all, we have to stabilize the patient, we have to stabilize the cervical spine to avoid the cervical injury during the intubation. First of all, we will clear the airway, or clear foreign body from airway, and we will insert the oropharyngeal tube and we will intubate the patient. Indication of airway intubation are unable to speak, confusion, and GCS is less than 8, and severe facial injury. In severe facial injury, or the difficult airway, or if the intubation is not possible, then we have to do emergency management. We will do cricothyroidotomy, and usually the cricothyroidotomy done in second and third tracheal ring, and usually in children we avoid the cricothyroidotomy to avoid risk of the subglottic stenosis. And in definitive management, we will do tracheostomy, through which we will give the 15 liter of the oxygen per minute with high flow oxygen. Second is breathing. We assess the breathing. We will see the respiratory rate, and we will examine the patient. We auscult the patient, and percussion, and we will rule out cardiac tamponade and open pneumothorax and tension pneumothorax. If there is the abnormal breathing detected, then we will give the oxygen first and ventilate if required, and attach the patient with pulse oximeter, and we'll see the oxygen saturation, and then we'll access the circulation. In circulation, we'll control the hemorrhage. First of all, we will apply the direct pressure on hemorrhage site, or bleeding site, and we will see the vitals. In vital, we will see the BP, pulse, and skin color, and we will insert the 2 large IV cannula, minimum 18 gauge cannula, and we will give the IV fluid, and we will give blood transfusion if required, or if there is a blood loss. And in case of, if the patient came with shock, if we are unable to find the vein and difficulty to find vein, then we have to use the central line in internal jugular vein, or femoral vein, or subclavian vein, as per situation. Indication of the central line are when if the patient is admitted in hospital for the long time, and we need to administer IV fluids, antibiotic, and painkiller for the long time, and in case of when the drugs are causes thrombophlebitis, like calcium gluconate, potassium chloride, and chemotherapy drugs, and we need the central line in case of when we monitor the central venous pressure. And D indicate the disability, and we will see the neurological examination, brief examination of the neurological, and we will see the patient is access the consciousness, and we will access the pupil,